So Medicare has two original parts that have been around since the 60s, parts A and B, and they're modeled after the old Blue Cross and Blue Shield plans where there was hospital coverage and outpatient coverage. Medicare designed itself that way, or our Congress designed Medicare that way, and it's been that way ever since.
Are you ready for a successful retirement? We're addressing the topics facing today's retirees. Welcome to Retire with Ryan. Now here's your host, Ryan Morrissey.
Welcome back, everyone. This week we have a special guest, Danielle Kunkle Roberts. She is a Medicare expert and has a best-selling book, 10 Costly Medicare Mistakes You Can't Avoid to Make. So be sure to listen to the end of the episode to find out how you can get a free copy of her book. Welcome, Danielle.
Hi, thanks for having me.
Yeah, I'm really excited for this episode, and this will be the first of 3 episodes where we'll be covering Medicare basics, Medicare Advantage, Medicare Supplement, as well as what to do, once you're enrolled in Medicare. So in this episode, we're going to review the basics of Medicare, its different pieces, as well as when to enroll and things to know about as you're getting close to that magical age of 65. So tell me a little bit about yourself, Danielle. How did you get into helping people with Medicare?
Yeah, so I started my agency back in 2005, and I used to work in the group and individual market. So a lot of people who are doing small group insurance are business owners in their mid-40s-ish, self-employed people. So we would help them with their group insurance. And over time, we started getting phone calls back from them asking about their parents. So, hey, you helped me with my group plan, and I've got mom turning 65 or dad turning 65, and nobody can understand this Medicare stuff. It's more confusing than what you helped us set up. So I heard that enough times, and I thought, well, I'm going to go take a look and see, what is this all about? Why is Medicare so confusing? And we found it to be unbelievably complex. It's actually difficult to believe the federal government would make it as hard as it is. And it takes a whole lot of learning to really understand the moving parts and then boil that down and explain it in plain everyday language to consumers and Medicare beneficiaries. But we tackled it and started helping people with that. And because of the number of people aging into Medicare, the baby boomers, 10,000 a day, are entering Medicare. It just took off very quickly. We had tons of people interested in help with Medicare, and it quickly overtook our business. And so we've been doing just Medicare ever since. We've stopped selling group and individual plans, and we help people now with primarily Medicare and a few ancillary things like final expense, dental, cancer plans. But we don't do any group insurance anymore because there's too many baby boomers that need the help with Medicare.
Yeah, I could imagine. And where are you guys located?
So we are in Fort Worth, Texas, and I have about 75 employees who work for me full-time, helping people in 48 states with their Medicare decisions.
Okay. Yeah, that's awesome. Yeah. And I think there are 2 states where Massachusetts being one of them, you don't have any choice. And
that's right.
Yeah.
So we don't help people in New York or Massachusetts. New York is due to rules about partnerships that are just more work than it's worth to overcome. And Massachusetts is one that we'll be picking up soon. We just don't actually get a lot of inquiries from that state. But I do have great agents that I know that service both states. So if anyone is listening and end up needing help with Medicare, we could certainly make a referral to a really reputable agent that could help in that state.
Okay. Yeah. Yeah. I think I was mentioned earlier before we started recording that I was a licensed agent for many years, but I never really dabbled in Medicare just because, as you mentioned, it was so overwhelming. And I refer clients from time to time to other agents, but I find that a lot of times, they don't really fully understand the policies, and maybe they only deal with one company or two, maybe. So what are some of the things that make your agency, your agents different from maybe the run-of-the-mill agent?
So we are a licensed independent broker, which means that we have contracts with all the major carriers that do business in the Medicare space. And so something you'll realize when you turn 65 is some of the big brands that have always provided the group health insurance that you had, they also play in the Medicare space. So you will find that there's companies like Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, Humana, and dozens more that operate in the Medicare space. And we have appointments with all of those. So if a consumer calls in for help with Medicare, first, we educate them on what the federal government benefits provide them first, because it's really easy to get distracted by the slick mailers that are coming in the mailbox every day about Advantage plans and supplements and try to tackle that and get overwhelmed before you even know what Medicare itself covers for you. So we start with the educational piece. guiding the client down the two main routes they can go with their Medicare choices. And then once we have narrowed down to one that seems like the best fit for them, we then go into a quote engine that we have, and we can pull up all the quotes and rates for the different carriers that work in that state. And depending on whichever one the client chooses, we help them enroll in that plan and we become their agent. The service is free because we're paid by the insurance carriers, but the benefit is the back end. So Medicare has all sorts of things that can go wrong. Your former employer could forget to tell Medicare that you are no longer working there and now Medicare should be primary instead of that group insurance. And so you go to the doctor and all your bills get denied. Your provider can send in the wrong code. There's 70,000 codes with Medicare and providers bill them wrong all the time. So the client will get a bunch of rejected claims and they don't even know where to start. Do they call their insurance carrier? Do they call Medicare? Do they call their doctor? And because Medicare is a new animal for them, they can quickly get lost in all those things. So we sort of make it a one-stop shop. If you get a bill that you're not expecting, you call Boomer Benefits. If your doctor won't take your insurance, you call Boomer Benefits. If you get a bunch of claim denials and you don't know how that happened, you call us. We conference in the right people to get things fixed quickly and easily because we do this every day. And it just takes a load off the mind of people who are already overwhelmed by this national health insurance plan that they don't know anything about and they've never been enrolled in before and is intimidating to them to begin with. We sort of take that piece out of it so they have that free claim support for life.
Sure. Yeah. I mean, that sounds great. I think just having one place to call is helpful for a lot of people. So we'll put a link in the show notes where you can reach out to Boomer Benefits and Danielle and her team. And I should say, too, that Morrissey Wealth Management, we don't receive any compensation. If you choose to reach out and work with Danielle, this is something that we do just to try to align our clients and our listeners with the best professionals out there. So for those who haven't listened, you can always go back to episode 19 to cover all of the Medicare basics. But I think it would be a good point now just to talk a little bit about the basics of Medicare. Can you tell me a little bit, Danielle, just how Medicare works?
Mm-hmm. So Medicare has two original parts that have been around since the 60s, parts A and B, and they're modeled after the old Blue Cross and Blue Shield plans where there was hospital coverage and outpatient coverage. Medicare designed itself that way, or our Congress designed Medicare that way, and it's been that way ever since. So those are the two parts that you sign up for down at the Social Security office or at the Social Security website when you turn 65. And they cover basically everything medically necessary that group insurance that you've had before covers, except for outpatient prescription drugs, which fall under a separate part, which is called Part D, that you buy directly from an insurance company. And something a lot of people don't realize is that Medicare isn't free. So while you work throughout your lifetime, you do pay FICA taxes that prepay your Part A benefits so that when you turn 65, if you've worked for 10 years and paid those taxes or a spouse has, you don't pay anything for Part A, but you do pay premiums for Parts B and D. And just like your current insurance, where there's deductibles and copays and coinsurance that you have to pay, Medicare has the same things. So people will have those out-of-pocket cost-sharing expenses as they use their benefits, which of course is why they end up buying supplemental products. But it's good to know that Medicare itself covers pretty much most things that you would find medically necessary. We do a new to Medicare webinar and I get all sorts of questions like, does Medicare cover my blood pressure medicine? Does Medicare cover my cataract surgery? If it's something that your current coverage that you've been used to having would have covered for you, most of the time Medicare covers those same things. What Medicare doesn't cover that's important to know is routine dental, vision, and hearing expenses. Those were not part of health insurance back in the 60s in the way that they are today through employers. So when Medicare was designed, it left those things out and you have to buy insurance for those separately or pay those costs out of pocket. It also doesn't cover long-term care. So Medicare will provide your medical needs up until the last day that you're here on Earth, but it doesn't pay for the expense of living in an assisted living home or a nursing home. And so there are costs like that that people need to be aware of that they should be saving for or planning to pay for in some separate manner.
Yeah, also care delivered outside the U.S., right? When COVID, well, it's lifting, but when people can travel to Europe, I guess, right? You get injured or get sick in Europe, you're out of pocket, I guess, for those costs, right?
Yeah, that's right. There are a couple of Medigap plans that you can purchase that have a little bit of benefit for foreign travel. And Medicare Advantage plans, I'm sure we'll talk about, they have emergency coverage. But we recommend if you're going to be in Europe or anywhere outside the U.S. for any period of time that's more than a few days, that you pick up some sort of travel benefit. A lot of travel agents have a medical-only claims that will cover you for 60 days while you're out of the country. Those are relatively inexpensive for the benefit they provide. And that's something, good point, yes, Ryan, that people should look into when they're traveling.
Yeah, that's great advice. So We mentioned earlier that 65, probably many people know, that's the point where then you can enroll in Medicare. And what is that, like, what time should people start to do that? Should they do it the day they turn 65 or a year before?
So you can sign up for Medicare up to 3 months before your 65th birthday. If you're already taking Social Security benefits, the government will assume that you have retired and you no longer have medical benefits, and they'll automatically enroll you. So your card will just show up in your mailbox a few months before you turn 65. But if you haven't done that, maybe you're waiting for a bigger Social Security check to your full retirement age or until age 70, then you need to initiate your own enrollment into Medicare during your personal 7-month window, which runs 3 months before your 65th birthday. It goes through that birthday month and runs for 3 months after. So that is your personal time to sign up for Medicare and know that you're doing things right and you won't be hit with a late enrollment penalty later. So if you know that Medicare is going to be your primary coverage, it's really important to do it during that window. But as many people are still working today, you may decide that if you have large employer coverage that is primary to Medicare, you might decide to delay enrollment into Medicare later. And there are special election periods that you can use to do that without penalty because you have creditable coverage. But most people who have already retired or planning to retire at 65 will go ahead and sign up in that 7-month window. And then they begin making their decisions about whatever supplemental coverage they want to go alongside that if they don't have retiree coverage or TRICARE or something like that.
Yeah. And so you mentioned working past 65. If you do work past 65, I believe you have 8 months after when you retire. That's the special enrollment period you were mentioning to enroll.
Mm-hmm. When you leave that employer insurance that's large employer 20 or more, that is going to trade places with Medicare. So most people work for a large employer. That insurance is primary and Medicare is secondary. I recommend that unless you're contributing to a health savings account, you still sign up for Part A to go alongside your employer coverage because it doesn't cost anything for 99% of beneficiaries. They've already paid those premiums with their FICA taxes, and it could reduce what you spend on your deductible on your group insurance if your group insurance has a higher deductible than Medicare Part A. So it can help you. It doesn't hurt you. And most people will sign up for Part A at 65 and delay the Parts B and D until later because that group insurance already has outpatient coverage and drug coverage. So no need for them to pay separately for those things in addition to whatever they pay in employee payroll deductions for that primary coverage from their employer.
Yeah, I mean, for some people, it might be less expensive, but for some people, it might be more expensive, right? I mean, there's a cost to Part B, right?
Yeah.
How much is that this year?
So in 2021, the standard base premium, which is what 95% of beneficiaries pay, is $148.50. If you happen to be a beneficiary with a higher income than most, which they consider $88,000 as a standard single filer with IRS or $176,000 as a joint filer, then you pay more. And depending on how much more you make, you can pay over $500 for your Medicare Part B. On the Boomer Benefits website, we have a Medicare cost page where each year we put up the new rates, and they're always looking at your income from 2 years ago. So in 2021, they're going to look at what you earned in 2019. And if it's below those thresholds, you just pay the base premium. But if you're in the 5% of lucky individuals who have higher income, you get to pay more for your Medicare because of that. And every year they look at the latest tax return that's 2 years back, and they recalculate that. So you may find yourself paying a little more for Medicare up front, and then it becomes less over time as your income goes down. But if your income has gone down because you've retired within that 2-year window, you don't even have to wait for Medicare to catch up with you. You can file what's called a reconsideration request through Social Security, showing them that you've had what they call work stoppage, and then providing proof that you're now retired. They will reevaluate that, and they may lower that Part B premium for you before the 2-year window catches up to you. So that's something you can look at as well. Some people, though, they have a lot invested. They work with people like yourself so that they have decent income through retirement, and they may always pay more for Medicare. And you want to know those numbers going in so that you can decide when to quit working and sign up for Medicare and know exactly what you're going to be spending for your coverage in retirement and not get surprised by Part B or D premium that is higher than you thought it would be.
Yeah, that's called IRMA, right? Income related monthly adjustment amount.
Yes, that's right.
Is when you pay more than the base Part B.
Yeah, we like to call it Ugly Aunt Irma. She comes in your mailbox and makes you pay her. We don't want that.
Yeah, poor Irma. So, I counsel clients a lot on Social Security. And for a lot of clients, if they can afford it, it makes sense for at least a higher earning spouse to wait until 70 to collect their benefit. So if they're now enrolling in Medicare, right, at 65, how are they paying for their Medicare?
Yeah. So if you have not signed up for Social Security yet, they're going to bill you quarterly for your Part B premiums. And they're going to bill you one bill, and your spouse also pays their own separate premium for Medicare. If paying that 3 months at a time is a hardship, you can contact Social Security or Medicare to sign up for what's called Medicare Easy Pay. And you could have them just draft that premium monthly from your bank account, which I think makes things a lot easier, because sometimes you'll get your IRMA bill or you'll get your Part B bill, which may or may not include the IRMA, and the numbers aren't what you thought they should be because for whatever reason, they billed you 4 months instead of 3, or they determined you had an IRMA and you thought it was going to be 148.50 times 3, but now it's this big number and you're surprised and upset. And you never want to let that bill go unpaid. So if there's a due date on it and you're in the middle of trying to fix it with Social Security, you should pay it anyway so that they don't disenroll you from Part B, which is a catastrophe because you have to wait then until the next general enrollment period. So I like to tell people to do the Medicare Easy Pay so that you don't get anything confusing like that. You know that you're going to be billed from 1 month at a time. But if you're fine with a quarterly bill and it comes in the mailbox, you just pay that. And as soon as you sign up for Social Security, though, they'll switch it to drafting that out of your Social Security check monthly.
Yeah, the government's good like that. They'll make sure they get their money, right?
They're going to get it the easiest way they can. We know that.
So what if you have one spouse that's not 65 and the primary spouse that has the current employer coverage now turns 65 and they go on Medicare? What happens to the other spouse?
Yeah, great question. So if the spouse that is leaving to go on Medicare is the one that has the group insurance and is carrying their younger spouse as a dependent, the younger spouse will have an opportunity to join COBRA, which they could do. COBRA is quite expensive, though, because remember, your employer was contributing toward that premium. On COBRA, you pay the whole portion, what you were paying and what the employer were paying. So you would look at the numbers for that and see if they're more expensive than what you want to pay. Your other option is to go to healthcare.gov and look through the exchange there to buy a personal plan for your spouse that will cover them from whatever age they are now until they turn 65. And there's all sorts of deductible options on the ACA plans that you can find through the exchange. So if you're relatively healthy, you could maybe go with a high deductible plan to keep that premium as low as possible until you can turn 65 and get on, of course, the more robust and much less expensive Medicare coverage.
Yeah, and there's been some changes too. That's something I work with clients, with as far as qualifying for a subsidy. I know it's based on the household size, but I think this year and for next year, it's based on a percentage of income. So more people might actually qualify for a subsidy than in the past, because it was kind of like cut and dry. If you went over the threshold, the AGI limit, you lost your subsidy completely. But now it's almost like tiered, right?
Yeah. And so a lot of people, may look at the COBRA and then they look online and they're like, well, the COBRA is only a little more expensive. But what you're being quoted online, if you didn't put in the income information right, might be the total premium. And if you qualify for the subsidy, the government's going to pay a portion of that for you, which can make that premium a lot more affordable. So being able to work with someone like you to look at that and anticipate what that might be, you could take advantage of a subsidy, could make that coverage way less expensive than what COBRA would have been. And so you just want to consider those things. Sometimes if you have somebody that is going through serious treatment, maybe somebody that's got cancer or they have some really expensive medications, maybe staying with COBRA not to rock the boat during that time is a good idea. But all of those things have to be considered.
That's true. Yeah. I mean, is there a good time of year to go on COBRA? Is it like best to do it at the beginning of the year or?
Well, with most companies, you're going to have a calendar year deductible, and COBRA is just a continuation of that insurance. So it may also depend on, maybe you do COBRA for a couple of months because you've already met your deductible for the year, and you may not want to switch to that healthcare exchange policy until later. And so those are all good things to work with a financial planner or broker on, because they may be things that you wouldn't consider. Same way when we have somebody that has an opportunity to either stay on group insurance or go on Medicare. If they don't take a lot of medications, sometimes leaving the group insurance and doing Medicare primary with a supplement or advantage plan is actually cheaper. But other times you have a really good group plan that it doesn't cost much. The employer's paying most of the premium or is covering some expensive medications for you. And in that scenario, staying with that group insurance and delaying Medicare as long as possible might work in your favor. So everyone's going to have a little bit of their own math to do when it comes time to decide what to enroll in so they can make the best choice for their personal needs or health and their budget.
Yeah. You just mentioned drugs. How does that fit into Medicare? Is that part of A or B or?
Yeah. So if you have medications that are administered in a doctor's office setting, so anything that's infusion or injection, chemotherapy, but also a lot of the autoimmune conditions now have drugs that doctors administer once a quarter or once a year, once every 6 months. And these are very, very expensive medications. And Medicare Part B will pay 80%. You pay the other 20%. So if you don't have a supplement to pick up that 20%, that can be pretty pricey, something you would want to consider. Now, if you only take outpatient medications, you can buy a Part D plan to cover those. And Part D, while it's far better than what we used to have with Medicare, which before 2006 was no outpatient drug coverage whatsoever, which was terrible for people for those 40 years, Part D is much better than it used to be. But Part D has some things that you may not be used to. So things like a deductible, which in 2021, Part D drug plans can have a deductible as high as $445. That means you spend the first almost $500 on medications out of pocket before the Part D plan kicks in. And so I would say that employer group health insurance drug coverage often is more robust. It doesn't have a deductible like that. It doesn't have a coverage gap in the middle where they cover less than they may have covered before. Part D has some wonky things like that, which can help a lot with the cost of medications, but could be more expensive than what you used to pay on your group insurance. And so comparing those numbers is important as well.
Sure. Yeah. And I believe there's a penalty, right, with Part B. If you don't enroll, you mentioned there's a penalty. Mm-hmm. Is there a penalty with Part D with the prescription drug plan if you don't sign up for that?
Yeah. And that's kind of surprising to a lot of people because it's voluntary coverage, right? You don't have to purchase it. But if you don't sign up when you're first eligible and you don't have other creditable coverage, either through an employer plan or perhaps like VA, veterans have drug coverage that's credible. They can get their meds from the VA instead of through Part D. If you don't have other credible coverage and you just choose to delay enrollment into Part D, there's two big risks there. One is you start accumulating a penalty, which is equal to 1% per month of the national average base Part D premium, cumulative, and you pay that penalty every month once you do join Part D. So let's say you waited 5 years, you're going to pay a 60% higher premium than the national base average. And drugs have inflation. So every year that penalty is 60% of a higher number and you're going to pay it for the rest of your life. So you can find drug plans in some states as low as $7 a month. At least enroll in the cheap one to make sure you don't pay the penalty. And then the bigger risk is once you decline the drug coverage, you can only get into Part D a couple times a year during annual election period that happens in the fall, October 15th to December 7th, or maybe you might have a special election period to a personal circumstance. There's a bunch of those. But if you don't qualify or you're not in one of those, you get sick in February and you need a $600 a month medication or a $5,000 a month oral chemo medication, and you can't get into a drug plan until the fall with the start date of the benefits not being until January 1, you could pay a lot of money during those months waiting to get into a drug plan. So those are the two big risks for why you shouldn't, of course, skip Part D.
Yeah. Sounds like everyone should sign up for it as soon as they can.
Yeah, absolutely.
Thanks so much, Danielle, for joining me this week. And be sure to tune in next week where we cover Medigap insurance, Medicare Advantage, and talk about which might be better for you. I mentioned at the beginning of the episode that I'll be giving away some copies of Danielle's book, 10 Costly Medicare Mistakes You Can't Avoid. I've purchased 20 copies of Danielle's book to give away to the first people that request it. And if you're already receiving my newsletter, my weekly Retire with Ryan newsletter that comes out every Wednesday, just reply back to that you'd like a copy of the book and your address, and I'll be happy to send you the copy. If you're not receiving the newsletter, then go to morseawealthmanagement.com, scroll down on the homepage, click sign up. And once you get your first newsletter, then respond back with the same information that you'd like a book and your address, and we'll mail it out. I would, however, request that once you do receive the book, that you also go to Apple Podcasts and leave me a review, an honest review if you haven't already done so, both a star rating and something that you've benefited from by listening to the course, as well as read the book. And once you've read the book, go to Danielle's Amazon book page and leave her a review. So I hope you found this episode beneficial, and I look forward to talking to you next Wednesday. Take care.
You should consult a financial advisor familiar with your specific circumstances before you make any financial decisions. Nothing in this broadcast constitutes a solicitation for the sale or purchase of any securities. Any mention of rates of return are historical or hypothetical in nature and are not a guarantee of future returns. Ryan Morrissey, CFP, is an investment advisor representative of Morrissey Wealth Management, LLC, a registered investment advisor.